There are many cases where migrant workers who become sick cannot receive medical care because of the burden of medical expenses. The reason they cannot afford to receive treatment is that they are excluded from the national healthcare system.
Mr. Aung Nae Wing is a Burmese who has been living in Korea for the past 12 years and has been continuing his activism for the Burmese democratization movement. 2 months ago, he felt extreme tongue pain and visited a hospital. After he was diagnosed with tongue cancer, he underwent a major surgery that lasted over 20 hours. Although his surgery was successful, he could not afford to be happy. He was at a loss as to how he was going to pay the 20 million Korean won that he owed the hospital, including the cost of the surgery and hospitalization.
이분 같은 경우는 지금 보험이 적용이 되지 못하는 경우이기 때문에 국내 보통 암 환자들과 달리 치료비가 많이 들게 되는데요. 수술과 관련된 비용만도 500만 원 이상이 들어갈 것으로 예상이 되고 이후에 재활이라든가 재발의 위험에 따른 추가적 치료가 필요할 경우 그 이상 1,000만 원 이상의 비용이 들어갈 수도 있는 상황입니다.
When a migrant worker is employed by a place of business, he or she is guaranteed to receive health care equivalent to the level of care that Korean nationals receive. However, due to a lack of concern on the part of employers and due to the lack of publicity and information, only 60% of migrant workers have health insurance and only 50% have accident insurance. However, even then, undocumented workers are not eligible for these insurance plans. According to an investigation by the Committee on Migrants' Health, the number of visits to doctors' offices or hospitals by migrant workers in 2007 totaled 361 visits. Among these, the highest number of visits was to the obstetrician's office with 160 visits. The problem is that because these migrant workers are undocumented, they cannot even receive obstetrician's care.
산재보험 같은 경우에는 미등록 이주 노동자에게도 적용 대상이 되거든요. 그렇다면 건강보험 같은 경우도 지역보험에 가입함으로써 미등록 이주 노동자들도 그러한 혜택을 좀 받을 수 있도록 해야 될 필요성이 있습니다.
It is not the case that migrant workers cannot get help at all. There are nationally about 708 free clinics that do provide medical support and service. However, due to the lack of publicity, many are not aware that such free clinics even exist. It is difficult for migrant workers to have access to this information, making them unable to benefit from the available medical service. We need to pay attention to the migrant worker population situated in this blind spot of the healthcare system in order to help them overcome these challenges.